Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor, and this is part 3 of our DVT and PE video. We've made it this far. This is the last video, but before we start, remember I am not your doctor. I am not providing medical advice. This is for educational purposes only. So let's finish this. Okay, now we're going to talk about length of treatment. Very important, and I get asked this all the time. So let's say you have a blood clot. How long will you or should you remain on this blood thinner? You have to decide, are you one of these two patients? So did you have a provoked blood clot or did you have an unprovoked blood clot? So let's talk about provoked. So this is simple. You're healthy, you're walking around, all of a sudden you fell, you fractured your hip, you were bedridden, and you developed a blood clot. So this fall and being bedridden from this temporary event provoked the blood clot. Or they found cancer in you. The cancer was removed. Now you're cancer free. Okay, so the cancer might have provoked the blood clot, etc. If you have one of these provoked blood clots, then you can take a blood thinner for 3 to 6 months, and then after that consider stopping. If you had an unprovoked blood clot, meaning you're at home, you're doing your activities of daily living, no medical problems, all of a sudden, boom, out of the blue, you get a blood clot. Where did this blood clot come out? Why did it develop? We don't know. Then that's an unprovoked blood clot. And if you think about it, if you develop the blood clot out of the blue and we stop your blood thinner, this blood clot can happen again. And these patients usually require indefinite anticoagulation, meaning they're going to need anticoagulation for a long period of time. Now, you also need to take into consideration for all these patients what other medical problems they have. Are they falling constantly? Do they have a history of hemorrhage or heavy bleeding? Do they have another underlying illness that increases their bleeding risk? And that's the discussion that you have to have. In other words, did they have a provoked or unprovoked blood clot? What are their other risk factors for bleeding or clotting? And then you have to make a medical decision. All right, now we're going to talk about follow-up. So if you had an unprovoked blood clot, we already know that we're going to keep you on blood thinners for a long period of time. Now, if you had a provoked blood clot and whatever provoked the blood clot has resolved, then we have to decide after that 3 to 6 months mark or time frame, can we safely stop the blood thinner? And what I do, I will repeat a lower extremity Doppler ultrasound. In other words, I want to look to see if that blood clot is gone. I will also perform a blood test that's called a D-dimer. If this blood test is normal or negative, meaning it's within the reference range, that tells me that you are unlikely to have a blood clot at that moment. And that's good information. I will also look at the symptoms. What symptoms did you have when you developed the DVT or the PE? I want to make sure these symptoms are gone. So if you are asymptomatic, meaning you feel great, you're back to normal, your Doppler ultrasound is negative, you do not have a blood clot at that time, and your D-dimer is negative, a test that has a very good negative predictive value for telling me that you are unlikely to have a blood clot at that time, I put all this information together and now I feel much more comfortable stopping the blood thinner. Now, obviously, if you still have a blood clot or if you still have symptoms, then maybe I will not stop the blood thinner. Now, the other thing I want to go over are blood tests that we call a hypercoagulable workup. We know that there are people out there that may have a genetic predisposition to forming blood clots. Maybe they acquired some sort of a genetic mutation, whatever the case may be. We have a bunch of blood tests we can send off. I'll give you some examples: prothrombin gene mutation, factor V Leiden, lupus anticoagulant. I can name several of them. Just know that these are blood tests that, if abnormal, tell me that you have a higher risk of developing blood clots. And sometimes we send these tests to help guide us as far as how long should we keep you on these blood thinners. The last thing I want to mention are patients that have had more than one episode. Listen, this is common sense. If you see a person has had more than one DVT, then you know they're at high risk for having another DVT. And this is a patient that I will more likely continue anticoagulation for a long period of time. In other words, I will treat the multi-clotter as a person who had an unprovoked blood clot. Again, long-term anticoagulation for those patients. Now, let's discuss this entity. It's called Phlegmasia cerula dolens. Very, very rare. This is something you do not want to develop. Luckily, it's something that usually gives you time and you can address unless you ignore the symptoms and the findings that you have. So let's say you have a blood clot in your leg and the swelling is getting worse and worse and the pain is increasing and intensifying, and you ignore it until it gets to the point that you have this huge, extremely tender leg, a lot of times totally discolored, very red, sometimes purple in color. And that's because this blood clot has gotten to the point that it is compromising your blood supply. And if you're not careful, you can lose your lower extremity. So if you notice that your lower extremity is getting very painful and it's getting worse despite being on blood thinners, make sure you seek help, medical help, because you do not want to develop this entity. Now, what can we do to try to prevent a blood clot? So this may be a person who's had a blood clot and wants to prevent a second blood clot from developing, or a person that has never had a blood clot, but maybe they have a strong family history, or they have a friend or a family member that, they've learned about DVT and maybe they're going to go on a plane ride. They want to reduce their risk. And there are things you can do. Number one, let's talk about the medication causes. So remember the medications we went over on the treatment section? Well, it would be one of those medications, but at a lower dose. So if you're worried and you believe that you may benefit from one of these medications, have this discussion with your physician, because a lot of times we'll give you a small dose. As an example, something that a question I'm asked all the time, I'm going to have a very long plane trip. So if I think that they may benefit, I'll give them a small dose of a blood thinner that they take right before getting on the plane, and this will reduce their risk. But again, not all patients require this, just a select few. The other thing you can do are non-medication treatment options, and that is walking, staying active, exercising, quit smoking, be careful with hormonal therapy. If you're on a plane, get up and walk down the aisle. Usually what I tell my patients who have a history, especially of a provoked blood clot, so these are the patients you're at risk, that you're afraid of. These are the patients I tend to give a medication, because since I know they had a blood clot in the past, they were treated for 3 to 6 months, and now I want to make sure they don't develop another blood clot. And they tell me I'm going to go on a long car ride or plane ride. What I do, I give them that small dose of blood thinner, and I tell them stay active. Talk to the flight attendant and just let them know that you're a patient that has a history of blood clots. Every 1 hour or hour and a half, 2 hours, you're going to get up and just walk up and down the hall, maybe do some squats on the aisle. I can tell you that most patients have told me, I spoke to the flight attendant, and once I told them that, they told me, absolutely, I know all about it. Believe me, you're not the only patient that has had a blood clot. This is unfortunately very, very common. So this concludes our talk. If you have a question that I have not answered, consider leaving me a comment and I will do my best to get it answered. Now, I am coming out with videos that have to do with blood-related issues and cancer. So if these are topics that interest you, please consider subscribing. Also, if there's a video that you would like for me to do on some other topic, also leave it on the comment section. So thank you for your attention, and I will see you on the next one.